Welcome to the deep dive. Today we're looking at something really tough for many advanced cancer patients. Malignant pleural effusion, or MPE. It causes awful breathlessness, often means trips back to the hospital. Now we know these indwelling pleural catheters, IPCs, they've been fantastic for letting people manage this at home.
They really have, a game changer for symptoms. But, there's been this underlying question, a real debate actually, about how often patients should drain the fluid using these catheters.
Right, like what's the best way?
Exactly. Should it be aggressive, like daily drainage, or is a less frequent, maybe symptom-guided approach just as good? Seems intuitive that more is better, right?
Yeah, I think so.
Well, two really key randomized trials, AMPLE-2 and ASAP-P, they set out to answer exactly that, and what they found wasn't quite what everyone expected. It really changes how we can tailor care.
Okay, so let's quickly remind ourselves. MPE, that fluid buildup, causes major breathing problems.
Significant breathlessness, yeah. And those hospital visits you mentioned, IPCs give control back to the patient, lets them treat it at home. It's empowering.
Definitely. So this core question, drain daily or less often?
That was the dilemma. Aggressive versus maybe symptom-guided or every other day. So the first study, AMPLE-2, this is international, 87 patients. They directly compared aggressive, so daily drainage, against symptom-guided drainage, looking at breathlessness, quality of life, and this thing called pleurodesis.
Pleurodesis. That's where the lung sort of sticks back to the chest wall.
Precisely. Which potentially means the catheter can come out eventually, a big goal for many.
Okay, and the second trial?
That was the ASA trial, U.S.-based, a bit larger, 149 patients. Their specific focus was comparing aggressive daily drainage to a standard every other day routine, really zeroing in on achieving autopleurodesis.
Autopleurodesis.
Yeah, spontaneous pleurodesis, where the lung sticks by itself, no chemical needed, just from the draining.
Got it. So let's talk findings. Breathlessness is the immediate concern for patients, right? You'd think draining daily must be better for that. What did they find?
Well, this is one of the surprising parts. Both AMPLE-2 and ASAP found no significant difference in controlling breathlessness between the daily group and the less frequent groups.
Really? No difference?
Nope. AMPLE-2, for instance, their p-value comparing breathlessness scores was 0.18. Statistically, that means there's no real evidence of a difference between the groups.
Huh. So for just managing the symptom day to day, both ways worked about the same.
Pretty much, yes. Equally inactive for that immediate relief.
Okay, so if breathlessness relief is similar, what was the big difference? You mentioned getting the catheter out, pleurodesis. What about that?
Now that's where the story changes. Aggressive daily drainage significantly boosted the chances of pleurodesis happening and made it happen faster.
How significant are we talking?
Well, in AMPLE-2, spontaneous pleurodesis at 6 months was 44% in the daily group versus only about 16% in the symptom-guided group. P-value 0.004, very unlikely to be chance.
Wow, almost 3 times higher.
Exactly. And ALP found something similar. Autopleurodesis was 47% with daily draining versus 24% with every other day draining. Again, highly significant. Plus, it happened quicker. Median time was 54 days versus 90 days.
So if your goal is to potentially get rid of the catheter, daily seems like the way to go.
That's the strong suggestion, yes. It's a major plus for patients hoping to be catheter-free.
But did this more intense daily draining cause more problems? Like more pain, lower quality of life, more infections?
That's obviously a crucial question, but reassuringly no. Both studies found things were pretty similar across the groups. ASC found overall quality of life was comparable, though AMPLE-U hinted at maybe some QL benefits with daily drainage.
Okay.
But importantly, both trials reported patients were highly satisfied with IPCs generally. No big differences in reported pain levels, time spent in hospital, or even overall survival.
And infections. That's always a worry with catheters.
Right. But again, good news. Aggressive drainage wasn't linked to higher infection rates or other serious side effects. Both AMPLE-2 and ASAP showed similar, thankfully low, complication rates overall.
That is reassuring. So putting it all together, what does this mean for you, the listener, or for clinicians managing these patients? How do you use this information?
It really points towards tailoring the approach. You have a conversation about goals. If the patient's primary aim is to get that catheter out to achieve pleurodesis, then the evidence strongly supports daily drainage, probably for at least, say, 60 days.
Okay, invest the effort daily for that potential outcome.
Exactly. But if the main goal is palliative, focusing purely on controlling the breathlessness symptoms right now, then symptom-guided or maybe every other day drainage is still a very effective option. It works well for breathlessness, and it might mean less daily burden, fewer supplies used.
So you can customize it.
Absolutely.
Right.
Based on what matters most to the patient, their overall condition, maybe even factors like trapped lung, although daily seem better even there.
Right. So thinking ahead, what are the next questions? Where does the research go from here to fine-tune this even more?
Good question. We could look at whether draining daily for longer than 60 days might help even more people achieve pleurodesis later on. Or maybe combining daily drainage with other treatments, like putting talc through the catheter. Could that boost success rates further?
Combining approaches.
Yeah, and wouldn't it be great if we could predict upfront who's likely to achieve pleurodesis? Developing some kind of predictive model could really help guide that initial choice of drainage strategy, make it even more personalized from day one. Maybe even explore if starting with twice daily drainage for a short burst helps. Lots to still figure out.
Definitely sounds like there's more to learn. But these trials give us much clearer guidance for now. Thanks for breaking that down.
My pleasure.